Welcome to Evidence Mastery with Dr. Masood Tusi. I am going to help you understand what asthma is and how it is managed. Please note that this video is for education only and will not replace your doctor's advice.
You know, asthma is one of the most common chronic respiratory diseases in the entire world. So in this explainer, we're going to break down the evidence together, really understand what's happening inside the lungs, how we as clinicians figure out a diagnosis, and what truly defines effective modern management. So here's our game plan. We're going to walk through 5 key areas. We'll start with the absolute basics, then dive into the biology behind it all. After that, we'll look at the diagnostic process, the core principles of management, and finally, what the long-term outlook is for living well with asthma.
All right, let's start at the beginning. We need to establish a really precise definition of what asthma is and get a sense of its scale as a global health issue.
At its very core, asthma is a disease of chronic inflammation in the airways. What happens is this inflammation makes your airways really sensitive or hyperresponsive. So in response to certain triggers, the muscles around those airways tighten up and narrow. That's a process we call bronchoconstriction. And here's a really key point. A defining feature of asthma is that this narrowing is reversible, meaning it can go away on its own or with treatment. This whole cycle is what leads to those classic symptoms.
And the scale of this condition, well, it's just massive. The evidence suggests that back in 2021, an estimated 260 million people around the world were living with asthma.
But what's interesting is that this isn't spread out evenly across the globe. The evidence shows a pretty significant difference. While the worldwide average is about 3,340 cases for every 100,000 people, the rate in the United States is nearly 3 times higher. That's 10,400 per 100,000, which comes out to roughly 25 million people affected in the US alone. It's a huge number.
Okay, so now let's dive a little deeper. What is actually happening inside the lungs on a biological level? What are the mechanisms that are really driving this disease?
When we talk about the biology of asthma, its pathophysiology, you can really think of it as 4 key things happening. First up, you've got bronchoconstriction. That's the tightening of the airway muscles. Second, there's airway edema and inflammation, which basically means swelling and irritation. This leads directly to the third point, airway hyperreactivity, where the airways just overreact to the smallest things. And finally, over a long period, all of this can lead to airway remodeling, which means permanent structural changes to the airways themselves.
This visual here really tells the story. On the left, you see a healthy airway. It's wide open, lots of room for air to flow. Now look at the asthmatic airway on the right. You can see how the walls are all thickened and inflamed, and that smooth muscle is squeezing down. This physical narrowing is the fundamental reason it's so hard to breathe during an asthma attack.
So, to really get a handle on that inflammation, we have to talk about the immune system. In the most common type of asthma, which we often call type 2 or T2 high asthma, specific immune cells are the main culprits. It's like having an overactive security system. You have these key players called Th2 cells, and they're kind of like the generals orchestrating the whole response. They call in other cells, like eosinophils, and trigger the production of IgE antibodies, which you might know are the very same antibodies involved in typical allergic reactions. This is exactly why asthma and allergies are so often connected.
Okay, so what kicks off this whole chain reaction? What are the triggers? Well, there's a huge range of things that can provoke an asthma flare-up. We're talking about allergens like dust and pollen, viral infections like the common cold, even just cold air or exercise. Then you have irritants like smoke, certain medications like aspirin, and even conditions like acid reflux or GERD.
So, with all these different symptoms and triggers, you might be wondering, how does a doctor actually confirm a diagnosis of asthma? Let's walk through that path to getting a clear answer. And that's a really important question, right? Because getting the diagnosis right is the absolute foundation for managing it properly. The evidence is clear that this isn't based on just one thing. It's a multi-step process. The whole diagnostic process really rests on 3 main pillars. It starts with taking a very thorough patient history, understanding the pattern of symptoms and triggers. Second, there's a physical exam, where we listen to the lungs, often for that classic wheezing sound. And third, and this is absolutely crucial, we use pulmonary function tests to get objective, hard numbers on how well air is moving. The main tool we use for this is called spirometry. It's a simple, non-invasive test. A key measurement we look at is the FEV1, or forced expiratory volume in 1 second. It tells us exactly how much air a person can forcefully breathe out in that first second.
But here's the real detective work, the key diagnostic clue. It's all about something called reversibility.
So, a patient showing some airflow limitation on the test is given a puff of a reliever medication. Then we rerun the test and ask the big question: did the airflow get better? A significant jump in that FEV1 number after the medication is a hallmark of asthma. It confirms that the obstruction isn't a fixed problem, it's reversible.
All right, so once the diagnosis is confirmed, the entire focus shifts over to management. The goal here is simple: to take control of the symptoms, reduce future risks, and let people live full, active lives.
When it comes to asthma medications, it's helpful to think of them in two big categories. First, you have reliever medications. These are your rescue inhalers. They act fast to open up the airways and give you quick relief when you're having symptoms. On the other hand, you have controller medications. These are the ones you typically use every day because they work on the underlying inflammation to prevent the symptoms from ever starting.
You know, managing asthma isn't a set it and forget it kind of thing. It's dynamic. Clinical guidelines recommend what we call a step-up, step-down approach. We increase therapy, step up, until symptoms are well controlled. Then, once things have been stable for about 3 months, we can try to step down the therapy. The whole point is to find that sweet spot, the lowest possible dose of medication that keeps things under control. But I really want to stress this: great asthma management is about so much more than just medication. Patient education is absolutely essential. That includes having a written asthma action plan, knowing how to monitor your lung function at home, and, of course, doing your best to identify and avoid your personal triggers.
Okay, let's wrap this up by talking about the long-term outlook and pulling together the biggest takeaways for living well with asthma.
And the good news is, the evidence we have on prognosis is actually very encouraging. For the vast majority of people who have access to good care and stick with their treatment plan, the outlook is excellent. Yes, asthma is usually a lifelong condition, but the key message is that with proper management, bad outcomes are largely preventable.
So, to bring it all home, let's quickly recap the most important things. First, work with your doctor to really understand your personal triggers. Know the difference between your quick relief reliever medicine and your daily controller medicine. Make sure you have a written action plan. And finally, always remember that staying on top of your treatment isn't just about feeling better day to day, it's about preventing those long-term, permanent changes to your airways we talked about earlier.
I hope you enjoyed this video. Please feel free to share your experience or questions in the comments. Please note that I won't answer personal questions. If you found this video helpful, don't forget to subscribe to my channel.